I want to welcome you. My name is Michelle Bartlett, and I'm the Director of Summer Sessions and Lifelong Learning at the University of Alaska Fairbanks. I'm going to tell you a little bit about how this whole thing came to be. In 2013, then Chancellor Brian Rogers sent me a note, and he said Tom Moyers had sent him a note that said, what about a course so that people could learn how to be healthy? I personally didn't think people would pay for that, aside from going to the doctor. So I said, I thought maybe a lecture series. So I got in touch with Mike Powers, who was the CEO of the hospital at the time. And out of that was a Healthy Living lecture series. We've been doing that now for 13 years, 10 each summer. They've all been recorded. You want to think about what you might have missed, you can go to the Summer Sessions website and they're all sitting there. And it's been a great series. However, we never talked about children. And so I thought this was something that would really, since more than half the population of Fairbanks are children. Is that right, Dr. Brunner?
Yes.
Probably. Maybe we should start talking about them. And so, fortunately, Laura, Dr. Brunner, and Dr. Nace and I had time and talked about it, and I was very pleased that they agreed that we could. We started this year. We just did two. We did one in the fall on the 11th of November. Michelle gave this talk on tips and tricks for talking with teens. I don't know whether you've ever had to talk to a teen, and how was your day? Fine. What did you learn? Nothing. How to engage. So anyway, if you would like to see the lecture that you missed, it's sitting on our website. Okay. Also, tonight, this talk will be on the web and by the end of the month, so your friends that you talk to and say, I was at this great talk, you really should see it, they can see it. uaf.edu/summer. And if you are not on the Summer Sessions mailing list or email listserv, I've got a clipboard and I would be more than happy to put you on our listserv so that you know about when things are coming up. We have a newsletter that goes out about once a month that just sort of fills you in. You don't have to stay on it if you decide you don't like it. It doesn't cost you anything, but it'll tell you about all the things we do, which includes Monday, Tuesday, Wednesday, Thursday. We have free things going on campus. There's a magnet on the table that you can put on your refrigerator. Music in the Garden, great family event every Thursday night, free concerts in the Botanical Garden. They start on May 26th. All right, that's enough of my infomercial. All right, because tonight Dr. Laura Brunner agreed to be here and give us a talk, which we're really looking forward to hearing. She is associated with the pediatrics at was with Patana Valley Clinic that has now emerged into Foundation Health Partners, and that pediatrics has been a shining light. And she is currently the medical director for the hospital and the NICU unit. In addition, her clinical skills and highly engaged community focus, Dr. Brunner is one of the most respected clinicians in our community. She is no-nonsense, skilled, and always well-prepared. All you have to do is, if you've ever been in a room with her with a child, you will understand that. She's a lifelong Fairbanksan who enjoys respect among patients, families, colleagues, and larger health network of providers in the community and the state. And on a personal note, I'll always remember when I brought my granddaughter Savannah in for a well child's checkup. Laura really engaged Savannah, and Savannah was engaged with her, and I was just the observer. So please help me welcome Dr. Brunner.
Thank you, Michelle. That was very nice. So I'm Laura Brunner. Thank you for coming this evening. It's like springy and sunny outside, and you came to sit in a cold room, so thank you for that. appreciate you being here. I'm excited to talk about this topic. I love kids, I love babies, and so pardon my enthusiasm in this moment. You can go to the next slide. We're going to kind of talk through a couple things. I start with kind of my perspective, some gratitude, and then we'll talk about babies for a minute. So you can go to the next slide. Thank you, Carol. And I have to move off to the side so I can read my slides a little bit. I do want to acknowledge that I'm going to speak in generalization. So I'm going to talk about babies do this, or you see this, or you hear that. Generalizations are really, really dangerous. Anytime you generalize things and say this is what happens, you're going to miss some of the kids that don't do that or that behave differently. So I want to just acknowledge that I'm using generalizations, but with respect that each and every baby is different, each and every family is different, and so you got to find your way through that. And really, each family has to find their own way with this amazing tiny human that lives with them. And what works for you might not be what works for your neighbor or your friend or your cousin or the sibling of that tiny human. I think that anytime you have a second kid, you realize all the things that you didn't learn with your first kid and why this one is different. And so if you have comparisons, if there are siblings in a family or cousins in a family, it does almost nothing other than humble you in what you thought you knew with round one that you learned with round two. And really, there is no one right answer. That if there were 10 questions and I could run through them from a multiple choice and be like, this is the answer, there's some stuff you try, and then you try the next thing, and then you try the next thing. So I just wanted to acknowledge that. And then acknowledge what Michelle said, which is I've had a great privilege of seeing kids and babies and families for almost 20 years as a physician. And families let me into those moments. They let me see their most exciting moments, their most scared moments, what they're worried about. They ask me the questions sometimes that they're embarrassed to ask other people or that they're worried about. That's a really humbling gift that I have received over the last 20 years, and part of what I talk about comes from that. I'm only an expert because people have shared that time with me. And so I'm not an expert in all things, anythings, or babies. I can just share what I have seen and what I have talked about. And I'm grateful for that, that I also appreciate that moment. And I want to acknowledge the people the last week up until 4 o'clock today that were emailing me questions to add to the talk and be like, one more, can you throw this one in there? So thank you for that feedback. So we will talk about babies for a minute. One of the ones that I get a lot, I get it in the NICU on the well baby unit in the clinic is, when can I take my baby out in public? So I have this brand new amazing baby. When is it safe for me to go out into public? And you can go to the next slide. And what I would say is there is no one right day. It's not like on day 10, it's terrible and scary and awful. On day 11, it's totally great and fine. That really that first month is kind of the highest risk from babies being around illness and infection of getting sick. Maybe the first 2 months, but it's kind of a gradation over time. Each day older they are, bigger and stronger they are, is probably safer from a getting sick standpoint. And really what you're thinking about in that first month or so is how do we decrease our risk? And that's going to be different for every family. You know what? If you're a new baby and you have a snotty 18-month-old sibling, I'm not going to be able to keep you apart because you live in the same house and your 18-month-old is going to want to love on you and kiss you and give you all the hugs in the world. And I'm not going to say lock them in different rooms because that's not how families work. The season matters. So in the winter, we have more, as you all know, coughs and colds and flu viruses and all of the things going around. Where you're going in public matters. So if you're going for a walk, if you're going to see grandma and grandpa, if you're going down the street, that's probably lower risk than hanging out at Fred Meyer's or Walmart or Safeway for a long time. Who you're around matters. So I love kids, they're super gross. Right? They sneeze right in your face. They wipe their nose right on you. They hug you all over with their germs. They're holding the beautiful baby and they will sneeze right in their face and then be like, what? So it is thinking about who you are around and how those people are feeling. So the other thing is kind of what can you do? So I always tell parents in the first month or so, blame me if you, oh, sorry, I have a microphone on. Blame me if you need to. Doctor said we need to try to not have people who are sick around the baby. So if you have a cough, if you have a cold, I would love you to meet this sweet baby right here over FaceTime. Yeah. Right? I would love you to meet this sweet baby in a week when your fever is gone and you feel better. Can I send you some pictures? That it's not no, you can't come, because humans are important to interact with other humans, and that includes babies, but it's how do we decrease the risk, particularly if you're sick right now. And then vaccines matter. So kids do routinely get some vaccines at age 2 months, and some of those are for kind of the cough and cold things that we see. So whooping cough is kind of one of the biggest ones that I think about in little babies, that we do have whooping cough around on a not infrequent basis. And that is a vaccine that kids get at 2 months. And then there are 2 other ones that are bacteria that cause ear infections, meningitis, and pneumonia. And those bacteria are kind of everywhere. They're at my house, they're at your house, they're at Fred Meyer's, and so we can't totally keep kids away from them, which is why we have those vaccines. So that is an option at 2 months for families. And then the same old boring stuff, right? Washing your hands. So I tell families when they have a newborn, getting in the habit of every time, everybody, before they touch the baby, wash their hands. So that's the toddlers, that's the grandparents, that's the parents, so that everybody's in that habit of, I'm going to pick up this sweet baby, oh, hang on, let me grab some hand sanitizer. So it just becomes part of the rhythm, particularly in that first month or so. So when can you go out in public? I don't know. It matters who you're going to see, where you're going, what time of year it is, what's important to you, what is valuable to you in terms of the time that you're spending with those people. But really the biggest risk is that first month or two, and making the choices from an exposure standpoint that are important and meaningful to you. And if you don't have to take them out into big public spaces in that moment, then don't. If you do, keep them with you. Don't pass them around the room to see other people. So how can you decrease those risks is kind of the way that I think about that one. Next question, why do we say they should sleep on their back and without anything in their crib? It's so boring, right? You see those beautiful cribs on Etsy and Amazon that have these beautiful bumpers and pillows, and like, I just want to go snuggle in them. Why do we say you can't have that? Next slide. So sleeping environment, and grandparents in the room, I am so sorry we changed this on you. I just want to acknowledge that. This is totally different than when you had babies. When you had babies, we said, have them sleep on their belly, they will sleep better, and we are worried that they are going to throw up in their sleep and choke and not be safe, right? And now we're like, oh my gosh, why would you put them on your belly? Put them on their back, right? We shifted that for a whole generation of people, and I just want to acknowledge that and apologize. Why do we talk about sudden infant death syndrome or sudden unexplained death syndrome or crib death? Those are kind of the words that you'll hear talked about with that. It's, I think, the scariest thing that lives in anybody's mind, right? The idea of that is completely terrifying for everyone that is around newborns or talks about babies. It's probably, the cause is probably a combination of a whole number of different things, and we may never totally figure out all the pieces. There's probably a little bit of a genetic risk factor. Preterm babies are more likely to have it happen than non-preterm babies. That there's some immature breathing centers, so babies' breathing is regulated in their brain, and it's regulated by a part of the brain that tells them to remember to breathe all the time, not just some of the time. And babies that are earlier just have a little less maturity in that space. And there's probably stuff we don't know. Right? We changed this on you in your lifetime. There's probably stuff that we don't know, and we will still figure out more surrounding this topic. That what we know is when we switched babies from sleeping on their belly to their back, that we decreased the rate of sudden unexplained death syndrome by a lot, by like more than 2 to 3 times. That's a huge amount when we think about a little thing like turning them over. What I also want to acknowledge is all babies sleep better on their tummy. They are happier, they are cozier, they are sleep better when they're on their tummy. But when we're talking about a risk of death in your sleep, that's why the flip happened, or that's why we talk about sleeping on your back. Sleeping environment, the recommendation is for your own sleep environment so that you don't have sort of other things like pillows and blankets and the most adorable stuffed animals right there next to the baby. And the reason for that is so that you have space to move your face and your airway kind of away from those things when you're little. So we do say horrible, mean things like removing blankets and pillows and crib bumpers and those sorts of things that are adorable, but certainly something that a baby can have their face up against. One thing that I always remind myself when I'm feeling sad about taking away those cute things from babies is the really, really young babies, they don't actually see them, right? If you need to take a picture with all of the cute things, take your picture and then take them back out of the bed when they go to sleep. Because if they are a 1-month-old, they don't see all the beautiful things in their space in that way. And you can add it back when they're old enough to move around and get around and lift their head up at that point. So the very young babies won't see those, and so better off to have a safer sleep space by removing those pieces. Next slide. why is my baby's poop a weird color? So I could not give a talk about babies without talking about poop, right? When I was asking people I was interacting with and they were like, what are you going to talk about? I was like, I don't know. What should I talk about? All the pediatricians I talked to, all the nurse practitioners on my team said, you have to talk about poop. And I was like, I'm not sure that's what Michelle's looking for, you know? Like, she's live streaming it. She does all this amazing work at UAF with summer learning, and I'm going to be the person who talks about poop. Okay, here we are. So I think one of the things to acknowledge about baby poop is it can be pretty much every color. Try to keep it in the earth tones family, right? Little tan, little green, little yellow, little brown. But really it can be anything, and it changes on you, and it can feel like this Rubik's Cube that I have to figure out, like, wait, it's green today. Why is it green? What happened? Was it what they ate? Was it how long they slept? Was it how they moved? And you can chase this until you're just going nuts with it. But I want to acknowledge there is green poop. There is yellow poop. Those first poops in the first few days of life are that black, sticky, tarry stuff that you have to like scrub off their bottoms. And in the first few days of a brand new baby, you're thinking to yourself, what am I doing? This is going to be the rest of my life, that I have to clean this sticky poop off someone's bottom. And pretty soon, by the time you've almost accepted that, you are moving to yellow poops and green poops that are up the back and into the hair and everywhere. I have seen poop, and families love to bring in poop and poop pictures when you're in the clinic. Like, this is my baby's poop, and this is my baby's diaper. And all I can tell you is that is so helpful. It sounds crazy, and it's actually very helpful when they're like, I'm sorry I brought poop. I'm like, great, get it out, let's look at it, right? Because it gives us a chance to have a conversation about it and actually feel like we're engaging with the same information. I have seen poop all the way from, I swear, neon yellow, through kind of a grayish color and everything in between. So what I tell families is I would like the earth tones from a poop standpoint. The color is likely a result of kind of the way the intestinal lining is, so what bacteria are in there at any given moment, how fast things are moving through. So bile salts, or the salts that turn your poop colors, comes from your liver into your intestine, and how fast it's moving and what moves in there certainly can make a difference in color. And then how the milk is digested and what milk it is. So is it hind milk? Is it fore milk? Is it breast milk with lots of hind milk or lots of fore milk? Is it formula? All of that can affect the coloring of it. Sometimes we certainly find that foods that a mom eats if she's breastfeeding can affect the color of the stool. I don't chase stool color if the kid's doing great. So if the kid's gaining weight and happy and feeling good, I don't care if it's yellow or green or blue or brown or whatever color it is in that moment, because if the kid's doing great and gaining weight and absorbing, that's wonderful. If there are things that mom's eating that are affecting the way the kid's feeling or the kid's gaining weight, that's when I start to chase kind of the maternal diet pieces of it there. But I will take anything in the earth tones category. Next slide. Oh my gosh, I have 2 slides about poop. Okay, so we're going to talk about dirty diapers. So somewhere around a month of age, and it changes for kids, somewhere 3 weeks to 2 months is kind of the range. If a baby is breastfed, they will start in that first kind of week to 2 weeks. They are pooping every single time they eat. So if they're eating 8 to 12 times a day, oh my gosh, that means you are changing 8 to 12 dirty diapers a day. And those of you that have done that know that the first week or 2, you're like, so this is my life now, right? Like, I'm just gonna change 12 poopy diapers a day. And those breastfed poops are kind of a, yes, we're going to say this, applesauce consistency. They're kind of a little watery with a little chunks in it, and they can be, oh my gosh, so loud it clears a whole room like this and up the back into the hair, or they can be a tiny little squirt. And then somewhere around that month to 2 months of age, they don't all, but they can shift where they were pooping 8 to 12 times a day. They can shift to pooping like, I don't know, once every 4 days. And that's really the great job that they are doing absorbing all of the breast milk. So breast milk is very easily digestible. They can kind of hang on to all the nutrients, and they may go to only needing to poop once every few days or so, sometimes even a week. It's kind of amazing because you just radically accepted that you were changing 12 diapers a day, and now they're a month old, and you're like, they haven't pooped in 4 days, something must be terribly wrong. Nope, every time you got them figured out, they change. And we kind of talked about seedy, watery earth tones as kind of where we are hoping to be from a poop standpoint in the first few months of life. I didn't even talk about once we had food in, because once we had food in, everything changes all again. So this is just in the milk land. The times I worry, so there are 2 times I worry about poop. One is if poop is white. So white for real is white, like the back of these slides. So a little gray with a little color in it, I'm great with. White poop in that first 2 months of life, come on in. We would love to see you and talk about it. And the reason why is because, remember I said the liver makes kind of the digestive enzymes and the bile salts that flow into your intestine and give it color. If that flow can't happen because it's blocked, we got to fix that fast. And so a white poop is a big deal that we'd want to hear from you right away. And bring a picture, bring a poop, because then we get to look at it and talk about it. And blood. So blood in the poop is something that, again, bring a picture, bring a diaper. It's actually really helpful to think about. There's lots of reasons why that could happen, but we'd want to think about it and look at it. So white and blood are the two reasons that I would want to look at poops. I mean, I always want to look at poops, but those would be the reasons. Okay, this one is hard. Is my baby getting enough to eat? Every parent in the room, every grandparent in the room, every aunt, uncle, cousin who's been around a baby has wondered this question at some point, whether it is a bottle, whether it's breastfeeding, whether it is food, but it is that inherent human nature, right? Part of how in our culture and many cultures we show caring is with food. And there's almost nothing that feels like it would hurt a parent more to feel like my kid was hungry and I didn't provide that for them or I didn't meet that need. And so I think it's a really kind of natural and tangible worry that we all have. And so I just want to acknowledge that piece of it. You can go to the next slide. In the first couple of months of life, babies only need milk. That's the only thing that they need. And when I say milk, I mean breast milk or formula. So one of those two sources of milk, so not the cow's milk from the grocery store, not their toddler sibling sippy cup. And the reason for that is breast milk and formula both have specific kind of protein and fat and nutrient content in it that cow's milk from the grocery store doesn't have. You can go back one, Carol. Sorry. And no water. So at various time points and in various cultures, we have given babies water. That first 6 months of life, they don't need water. They're getting plenty of liquid in the milk that they're drinking. And if they fill up on water, then they don't drink as much of the milk that we want them to drink. It can also affect their salt levels. So baby kidneys are not the smartest kidneys in the world. And so they have a harder time hanging on to some salts and fluids compared to how our kidneys work. Or at least I hope all of our kidneys work. And so we don't want to feed them water because it just doesn't clear their kidneys kind of as well as it would in an older kid. And then one of the things, particularly in that first 2 to 4 months of life, is not adding food to the bottle. So we've all heard of adding rice cereal, of adding a number of different products. I won't give any good ideas away, but adding a number of different food items to the bottle with hope of kind of filling them up or making them more full. Not something we want to do in the first few months. Kind of same thing, can affect digestion, can affect their kidneys, can affect how much of kind of concentration of the milk that they're eating. So the great news is all they need is breast milk or formula in the first few months. You don't have to add other stuff or get creative with that part. Signs they are getting enough. So it's kind of a bummer, right? They don't come with a fuel gauge that you're like, oh, great, we're full. And breasts don't come with a full fuel gauge of, oh, great, we're empty. And so you can't measure that tangible amount of like, here is how much my kid got. And that can feel really unsettling in a number of different ways. The ways that we can look at kids from a feeding standpoint is we're really looking at that weight gain. So in that first days to weeks, we are obsessively weighing babies, right? We're like, okay, we want to see you again. You're leaving the hospital. That's great. I made you an appointment for tomorrow. Okay, great. You know what? I'd like to see you again in 3 days. Okay, great. I'd like to see you again in 3 days. If we're watching that weight gain pretty closely, and sometimes it can feel like, oh my gosh, what are we doing getting weighed all the time? And that's really looking at this kind of transfer of milk and how is that changing from a weight gain standpoint as a marker of how our kid's doing with eating. And then looking at regular wet and dirty diapers. So when I talk about wet diapers and dirty diapers, it's not uncommon in the first day or two that families will ask me about that. And when I'm talking about the first 4 days that I'm generally saying, okay, first day you should have 1 poop and 1 pee. Second day you should have 2 poops and 2 pees. Third day you should have 3 poops and 3 pees. Fourth day you should have 4 poops and 4 pees. After that I have no idea. So in the first 4 days, I can give you pretty good numbers of what I should see, and that I'm looking for, are you transferring milk? Are you processing milk? Are you hydrated? And I expect those first few days to be much lower numbers. After that, it should be a lot. you should have a lot of pees, you should have a lot of poops, but it shouldn't keep going up forever in the numbers category like that. If you are 90 days old, you should not have 90 pees and 90 poops on that day. But at 4, then we stop doing that kind of math. But you're really looking at that. If you are going a whole day without peeing as a baby, after that first couple of days, we don't have you hydrated to the place where you need to be. And so we need to think about that part. And then most of you know that kind of baby that has a full belly and is in like that happy, satisfied milk coma, right? Like I just ate, you could slam the door, the dog could bark, and like the kid is happy and out. That's what we're looking for with that happy, satisfied after a feed. And then just acknowledge feeding challenges are hard. Every baby that has had to, and family that has had to work with a baby, whether it is bottle feeding, whether it is working on breastfeeding, whether it is working on milk supply, whether it is working on how do grandparents feed, how does this work, convincing this kid to take a bottle from grandma and grandpa, right? Every piece of those is hard because we have that inherent, I want to feed this child, I want to feed this baby. And so there's all kinds of thoughts and feelings wrapped up into that. And I just want to say one more time, there's no one right way to do this. There's some rules of engagement. Don't feed them water. Don't feed them apple juice. Don't dump a whole bunch of extra stuff into their bottle for a midnight snack. They should just have formula or breast milk, and they should have enough to gain weight, feel full, be happy, poop, and pee. Okay. Feeding frequency. So how often do you feed? You guys are noticing a theme. It depends, right? Depends on the kid. It depends on their medical condition, depends on what they're eating, depends on how old they are, depends on how big they are, and depends on their weight gain. So when you are here in the hospital after having a baby, we're pretty prescriptive, right? I want them to eat every 2 to 3 hours. Most breastfed babies in the first month of life are eating 8 to 12 times a day. Holy smokes, 12 times a day, that means every 2 hours you are feeding that baby. Every 2 hours is from start of a feed to start of a feed. If it takes you a half an hour to feed the baby, that means you feed the baby, you change the baby. That takes you 45 minutes. You get to sleep for an hour and 15 minutes before you start the whole thing over again. Oh my gosh, congratulations, it's gonna be amazing, right? What I wanna say is it's temporary. It doesn't stay that way forever. So when you're in the hospital and we're saying things like, feed him every 2 to 3 hours, and we say it with a straight face, like that's no problem, right? Like, just do it, have a great night, see you later. It changes, it gets better. It doesn't stay that way. Eventually they will sleep 4 hours in a row and it will feel like the most amazing thing that has ever happened to you. But babies in the beginning do need that super frequent feed, and then as they get older, it does space out with time. The reason I put this up here is my kind of favorite go-to website for parents is this one called healthychildren.org. So it's a parent website. It is written by the American Academy of Pediatrics. It has all kinds of different stuff on it. It has videos. It has different lists. It has a ton of different resources on it through teenage years. So as Michelle said, my colleague, Dr. Nace, is a uniquely gifted communicator with teenagers, and she talked about teenagers earlier this year, and I shifted and went the other direction to talk about babies, and this website covers the whole range of all of those, and you'd be surprised how many similarities there are in communicating with babies and teenagers. So some of the skills that you learn for a teenager also work for a baby, I will just say. These are kind of two of the ones that I like, and it's just talking about the first month feeding and nutrition and what does that look like and what are some tips. And then the second one it's called responsive feeding, but it's this idea of working with your kid and using your kid to tell them when you're full and when you're not full and when you're hungry, as opposed to having a super rigid schedule. And every kid is going to be different, and some of that works and some of it doesn't work for each kid, but this is kind of my favorite website to look at for that kind of information. We go to the next one. Oh my gosh, right? Why is my baby crying so much? So I think any of us who have been around babies have asked ourselves this question at some point. It might be a moment of weakness at 2 a.m. It might be as soon as someone hands you the baby, but why is my baby crying so much? So you can go to the next one. Oh man. So I think we think sometimes like, okay, why are they crying? I'm going to stretch out. I'm going to be ready. I'm going to solve this problem, right? This is calculus. I'm going to start with this. I'm going to start with this. And eventually I'm going to solve why the baby is crying. Sometimes, right? Babies cry to communicate. Deciphering the cries can feel kind of overwhelming, like I've gone through my checklist and they're still crying. All of us have been at that point. Tangible reasons, we all know this, right? They're hungry, they have a dirty diaper, they're tired, they're overstimulated, they have gas. Also, they could be sick. Also, they could be fine. And it could be just a day that ends in Y, right? Like sometimes you can go through your whole list and have everything figured out, and the reason they are crying that day is, we don't know. It was a Tuesday, and they just had a Tuesday, and next time it will be Friday. That part of crying is that moment of them sort of making those connections in their brain, figuring out how do they do all the things they do, and one of the skills that babies have is crying. Every parent has had that moment when you've done everything on your checklist and nothing works. So we have checklists, we have reasons why they cry. Sometimes it's really easy to figure out. You solve it, you're done, moving on to the next thing. And sometimes it is completely exhausting and overwhelming trying to think through, is there a why, and why can't I figure out what it is? The things to do, right? You guys know this. It's swaddling, it's rocking. It's that every time I pick up a baby, I start bouncing, even if the kid's like 4 and I can't figure out why, I'm still bouncing, and then I'm like, I don't need to bounce this baby. I can hold still like a normal person. Using things like white noise, using things like communication and sounds, pacifiers, taking a walk, going out in a stroller, all the tricks that everyone has used. And sometimes there's patterns. Sometimes it's worse in the evening. Sometimes it's worse in the middle of the night. Sometimes it's worse in the morning. Sometimes there are cries that you learn. Oh, that's a hungry cry. Oh, that's a my brother just stepped on me cry. Oh, that's a I need my diaper changed cry. So sometimes there are definitely patterns that you can figure out with it. It's also really important to take care of yourself. So when you are in that moment of, I've spent 45 minutes with this baby who will not tell me what is wrong or use words to communicate or go to sleep, what do I do? Recognizing how stressful that is, how hard that is for you. And every parent has had a moment of, I can't do this anymore, right? That as you are thinking, being there with that baby, thinking, I just need you to be quiet. I can't do it anymore. And you hit that wall. And recognizing that's a human reaction. That's normal. Doesn't mean you don't love your baby. Doesn't mean you don't care about your baby. But when you hit that wall, handing that baby to a friend, handing that baby to a partner, or setting that baby down and saying, I gotta take a minute. I need a minute. I need 5 minutes. I need 10 minutes. Because when you hit that wall, the hardest and scariest thing that we can't change is if you hurt that baby. And no parent wants to hit that wall and feel like they made a choice that they can't change or they can't come back from. So it is always okay to set that baby down and say, I'm gonna just go get a cup of tea. I'm gonna walk a lap around the house. I'm gonna yell at the wall myself, whatever you need to do in that moment. But it's really important to make sure that you take care of yourself. And the second piece of that is recognizing who are the people that can help you. So lots of times in families, in friendships, in our culture, we have a little bit of an attitude of, I'm fine. I got this. No problem. How's life with your new baby? Oh, it's good. Right? Think of who are the people that you can say, last night was really hard. Any chance you can come hold my baby for an hour while I take a shower? Any chance you could come over while I vacuum? Right? What are the things that you need to do to feel like you are taking care of yourself, that you are having a path forward for the next step? That it is really unusual when you have people that you care about and you ask them for a tangible moment, come over for an hour and hold a baby. There are very few people who offer, right? They're offering to help, who, when you say hold a cute baby, are like, no, I'm good. Everybody loves a cute baby. Even when they're crying, they can do an hour. They can walk for an hour. There are lots of grandparents, there are lots of aunts and uncles and cousins and friends and neighbors. And there are lots of people in your life that have probably been in this moment. They know what it feels like. And while they're probably grateful they don't have a newborn in this moment, they're more than willing to help you for an hour or 2 hours to find a moment of sanity back. So I think it's just really important to think about how are the ways that you can ask for help. And when somebody says, how are you doing? That you can say, I'm doing okay, but you know what? Are you offering to help? And if they say yes, you can say, great, how's 2 o'clock tomorrow? Can you come for 1 hour? and hold my baby so that I can feel like I have some space, so I can take a shower, so I can run to the grocery store, so I can sleep, so I can do something that fills me back up so that I'm ready for that 2 a.m. moment again. Next slide. Because it's hard, right? I Googled when I was making these slides. Sometimes I like to use Google as my information source. And I Googled, why won't my baby stop crying? You should just try it sometime. It's really entertaining to see what's there. These were the top 3 pictures that were there. And I feel like it's telling because you look at them, it makes my cortisol level go up and my heart beat fast to look at those pictures. Because I'm looking at those faces and going, oh my gosh, look at that pouty bottom lip, you guys. Like, that kid is sad. Look at that newborn up there. Like, I can hear the shriek of that kid up there on the top and this one on the bottom. Like, it draws an emotional reaction out of us for a reason. This is how babies survive, right? Evolutionarily, if they didn't draw this reaction out of them, we'd be like, see you in a week. And we'd check out and walk away from them. But the fact that we have this reaction to crying is how they stay alive, because we show up, we take care of them, because they can't do it on their own. The times when I worry, so when it's that different cry, something is wrong, it's louder, it's more high-pitched, it hits that part of you and you're like, ugh, something's wrong, I gotta go figure out what's going on. Really can't console them. So you've used every tool you have. We've been walking for an hour. I can't even get 10 minutes of quiet here. Gets my attention, gets me thinking a little bit about it. Hard time breathing, right? Breathing is important, even when you're crying. And so if they are having a hard time breathing consistently with it, or they're stopping, so babies will do that, right, where they're crying and then they just get so sad that they have to like stutter, catch their breath on the way in. I'm cool with that. It's very sad, it's heartbreaking, but it's not dangerous to have that happen. This is the like, I'm crying and then I just give up for a little bit and don't breathe, and then I cry and then I give up for a little bit. That's got my attention. And if you turn blue, I mean, it feels like a good rule of thumb. If you turn blue, I'm worried about you. And so if babies are turning blue when they're crying, and I'm talking blue lips, blue face kind of thing, then come on in, we'd love to see you. And I think I just want to validate one of the most common things that we see in the clinic, in the emergency department, in the urgent care is, I'm not sure if we're okay or not okay, but we've been crying, can you help us out? Always happy to see those babies, always happy to look. There are reasons that babies can be crying, and sometimes just having a look in their ears, a look in their throat, a listen to their heart and lungs, feel their belly, look at their weight, those sorts of things. You can say, you know what, I think we're okay. Here's when I'd want to see you again. And it gives you the peace of mind for at 2 in the morning when you have a crying baby that they've been looked at and they've been evaluated. So I just want to say, always happy to look at them. And my hope is we look at them and we say, you know what, they're doing great. And I'm so sorry last night was awful. And guess what, tonight might be too. But they look really good right now. And that's a really helpful thing to have. And then just to validate, crying is rarely a sign of serious issue or serious illness, but always happy to look if you have that spidey sense, that parent sense that something isn't right, and I want to look at this. What do I do about all the common things, right? A fever in a baby, a diaper rash, a spit up. You can go to the next one. So I just want to define what a fever is for a baby, so we have very strict definition, and that is any baby under 3 months, a temperature of 100.4. I say 100.4 because I talk fast and people hear me say 104, and I'm like, no, 100 with a decimal point and then a 4 after it. That is 38 degrees Celsius if you speak Celsius. But either of those two numbers, whichever measure you use, that's a baby emergency. So in my toddlers, in my big kids, in myself, if you're 100.4, I'm like, bummer, here's some Tylenol, here's some ibuprofen, let's see what happens with it, right? A baby, one time, any way you measure it, 100.4 or higher, under 3 months, come on in, that's an emergency. We want to see you either in the emergency department or the clinic or the urgent care right away. The reason for that is babies' immune systems are not great. They are not good if they get an infection in one place and keeping it in another. So if they get a urinary tract infection, it can pretty quickly spread from their urine to their blood, to the fluid around their spine and their brain. Big kids, grown-ups, we can have a urinary tract infection for days before it starts trying to go other places most of the time because we've got an immune system that's working to try to keep it in that place. Babies don't have that same immune system, and so a temperature like this, we'd want to see them right away to think about those things. which is a totally different set of rules than after 3 months of age, or than at 6 months of age, or the 3 years of age. See, I said we were going to keep moving targets on you. This is an example of that. One of the other things, just to make sure people that are taking care of babies are aware of, is ibuprofen, Motrin, Advil, whichever brand name that you have, not okay for babies till they're 6 months old. So Tylenol you can use early. Tylenol or acetaminophen can be used before 6 months of age. But ibuprofen, Motrin, Tylenol, not until 6 months of age. And the reason is that ibuprofen, Motrin, Advil, those are cleared by the kidneys. And I said the kidneys weren't the smartest in the first few months of life. And so it can lead to kids not clearing it super well. So that's why we say no ibuprofen, Motrin, or Tylenol till 6 months. Skin, oh my gosh. So babies, particularly in the first week or so, will have, it's not uncommon for their hands and their feet to be super dry and peely, and you put lotion on it, and 5 minutes after it looks like you never put lotion on it. You put lotion on it again, and it looks like you never put lotion on it, and you're like, I swear I just put lotion on it. And then your mom comes over and she says, you gotta put lotion on that baby. What are you doing? And you're like, I'm so sorry. I just did it 5 minutes ago. I promise. That is kind of, if you think about a baby is living in water for 10 months, right? 40 weeks they are in water. Then all of a sudden we put them in the air. Their skin is dry and peely, and it takes a while to kind of adjust to that piece of it. So hands and feet are the most common place, but they can be super dry in that first week or 2 weeks. And they can have all kinds of crazy rashes, right? So there's baby acne that's kind of on the face, sometimes on the forehead. They can have this crazy rash on their body in the first week or two that's like these red splotches that almost look like they have a pimple or a dot in the center. And we have to have fancy names for everything. So we call it erythema toxicum. So we sound smart. Really, it's a baby rash, and it goes away, and it doesn't bug them, and they don't care. But same thing, your mom comes over and is like, oh my gosh, have you seen this rash on your baby? You have to take them to the doctor. It looks awful. Google it if you have a baby, so when your mom comes over, you can be like, no, it's not. It's erythema toxicum, Mom, and we're fine. Thank you so much for asking. There are cuts, breaks in the skin, all those sorts of things. If you have something new on your baby that you're worried about, we'd want to look at it. That I see baby rashes all the time, and I have lots that I'm like, oh, cool, sorry, it's going to mess up the pictures, but the baby is fine. And there are some that I'm like, come on in, let's take a look and figure out what this is. So there are great pictures all over the internet. About half of them are correct. So I would again refer you to that healthychildren.org website, because there's some great newborn rash pictures on there. And then to talk about diaper rash. So the big thing with diaper rash is the common kinds of diaper rash are typically a kind of red bottom or some little bumps on them. And it is mostly, again, I'm going to talk about poop, guys, when you have skin and you have poop or pee. And when they sit on top of each other too much, it can get irritating and it can get red. If the baby has a nice long sleep and they pooped right before they went to sleep and forgot to tell you about it, they can have a pretty good diaper rash a few hours later. And that's not because you are a bad parent and didn't change their diaper. That's because they didn't give you a warning sign that they were pooping in their sleep, because they're a baby and that's what they do. Diaper rash creams, everybody has a favorite. There are lots of different kinds of them. There are some for one baby that people will swear this is the one that works for this baby, and then there'll be another one and that same one won't work for that baby, and that is all okay. It is kind of like Coke and Pepsi. Everybody has a favorite, but you find what works for you and for your kid, and it's okay to try a bunch of them out. In general, I like thick, heavy, greasy. So both for lotion and for diaper rash cream. So for a baby with dry skin, I like thick, heavy, greasy stuff. If I have to scoop it out of a tub and smear it on the baby, that's gonna be great because it's gonna stay on and they can't talk, so they can't complain that it feels greasy. The 3-year-olds can tell me it's greasy and I'm like, I'm sorry. The baby, I can lube them up all over with the greasy stuff. From a lotion standpoint, if you have to pump it through a pump, it's thinned out, so it has alcohol added to it to make it thin enough so you can pump it through a pump. That makes it evaporate a little bit faster, so it doesn't kind of last as long on the baby. From a diaper rash cream standpoint, what I'm trying to do is keep skin on one side and poop and pee in the other side and something in the middle. So if you're putting diaper rash cream on, thick, heavy barrier is what you're going, so there's something in between the skin itself and the poop and pee there. One of the other things that comes up with diaper rash cream is when you put it on and then the kid poops and pees, then what do? Do you have to get all of it off? Do you have to get in every little crevice to get it all off? You don't. do your best, get most of it off, get the poop and pee off, but you don't have to scrub in each fold to try to get all the diaper rash cream on. And you can, if a kid has a rash, put the kind of diaper rash cream, the ones from the store, so Desitin, butt paste, Balmex, those sorts of ones, you can put those on with every diaper change if you need to. So some of the prescription ones or the medicated ones that we're using will say things like 2 times a day or 3 times a day. But with the thick, heavy barrier cream, you can put it on every single time because all you're trying to do is keep skin on one side and poop and pee on the other side. And then to talk about spit up. Oh man, spit up, right? Every baby does it. It's a matter of when and how much and how bad. Small, frequent spit ups, and when I say small, I mean when they spit up, it comes out and it's that big, or it's the size of their face, but it's not the size of their whole body. And they're pretty common. My favorite kids are the ones that spit up, it dribbles down their chin, it lands on the blanket that they're laying on, and then they start playing in it, right? They're fine. They don't care. They think it's hilarious. They have a new toy to play with. It didn't hurt them. It didn't bug them. It's a laundry problem, right? The baby is fine. They are playing in the spit up, but you now have a dirty shirt, a dirty blanket, and when you pick them up and hold them, you will now have a dirty shirt. And so that kind of spit up is not a baby problem, it's a laundry problem. And I'm sorry, we just talked about what you can ask your friends to do to help you. You can hand them a bag of laundry and say, could you do this for me, and give it back. The spit ups that I worry about, those are the kids that are hurting when they spit up. So they are crying that pain cry, they are kind of miserable, can't get comfortable. All babies have some degree of reflux or food that's moving from their belly up and down their chest. And sometimes it comes up and sometimes it comes up and they swallow it. They kind of, and they'll swallow it back down. Sometimes it comes out their nose. Sometimes it just comes up to their chest and they wiggle and they squirm and they kind of push it back down. But all babies have food moving in that way. And part of the reason is the muscle at the top of their stomach that's a circle, so it has to be able to close and hold food in their stomach. That muscle is floppy like they are floppy. Think about a baby, right? You can move them all over, you can turn them over, and they are just floppy. That muscle is floppy too, so as they get older, it gets stronger, and then it can hold the food down better. The times I worry, again, are if they're hurting. So with those spit ups, instead of playing in it and thinking it's hilarious, they are screaming like that was awful, and that's kind of that heartburn or that pain kind of feeling there. If they're not gaining weight, so if they're spitting up so much they can't gain weight or they can't swallow and eat because they're hurting with this, then I worry about that. If there's blood in the spit up, I told you I love pictures of poop. I love pictures of spit up too. It helps us kind of think about that. Or if it is shoot across the room spit up. So it is a large, oh my gosh, we've been having the happy playing on the blanket kind of spit up, and all of a sudden today we've had 6 times it is shooting across the room. I would want to hear about that. The one I didn't write on here, and I apologize, is bright neon green spit up. So I told you I love earth tones in the diaper. I don't love earth tones coming out the other end. So if you have bright neon green coming out of the top end, that is a come on into the emergency department. We'd want to hear about that kind of thing. So earth tones are great from the bottom. They are not great from the top. Okay, next one. How often do babies need a bath? So I will tell you, I have parents, and I have parents who are grandparents, and I like to ask this question to them and some of their friends, and I can tell you every grandmother and grandfather has a right answer to this question, and the standard deviation on the number that you get is very wide, ranging from daily to monthly. So I have done an informal, non-IRB approved, non-funded study over the last month of asking this question, and everybody will say it with confidence. They're like, once every 3 days. Like, why would you ask? That's obviously the right answer. And so as I think about this question, again, noticing a theme, there is no one right answer to this. You can go to the next slide. When I think about newborns, so newborns in that first week or so of life, they have been living in a bath, right? They are now coming out to the air. Most of the time we do a bath in the first day or so, but we're really trying to make sure we're promoting all the other important jobs of being a baby first. Maintaining your temperature, bonding with your parents, learning how to eat. A bath is not the thing that has to happen right in the first hour of life. That is a huge change from where we were, 30 years ago in terms of thinking about taking care of babies, but it's really much more important that you are with your family, learning how to keep your sugar stable and your temperature stable, and learning how to eat in the first few hours of life. They have dry skin. So they get a bath, they need their hair washed, probably in the first few days of life if they have long hair and happen to have all the products of birth in their hair. But they don't need a bath every 5 minutes, and they have dry skin. So giving them a bath all the time just makes them more dry. That umbilical cord, when they are born, is kind of a gooey texture that dries down like a scab in the first few days. And so if they still have an umbilical cord attached, you don't want to set them in a bathtub. So setting them in a bathtub kind of rehydrates that scab. And you've all seen a scab that, like, you took a shower or a bath and then it's gooey afterwards. That's what happens with the umbilical cord. So you don't want to put them in a bathtub till that umbilical cord has fallen off. Usually that's somewhere around a week to 2 weeks. And so what do you do if they're a week old and their umbilical cord is still attached and they poop all the way up the back into their hair? A sponge bath. So you can rinse them real quick. You can kind of clean them with water. It's not that you can't clean them, it's that you don't want to actually immerse them in a bathtub till that umbilical cord has come off. And then to just say infrequent baths in the newborn period, they're okay. If it happens once every 3 days, if it happens once a week, it doesn't have to be on a schedule, that it can be kind of enough to say, you know what, you got poop all over everywhere, I should probably give you a bath today so that we take care of that. But it doesn't have to be a set frequency or something that happens every single day. And that's going to be different for different families. Are you in a dry cabin? Do you have running water? That it's hard in the beginning logistically to do a bath. I said babies are floppy. They don't tell you what's happening. You really want to think about kind of getting yourself ready for the bath. So in a baby bathtub or in the tub that you have, thinking about the water temperature. So they can't tell you what they like from a bath standpoint. And so making sure that your temperature, so 120 degrees is typically where we say set your hot water heater if little kids are going to have access to being able to run the hot water so they don't burn themselves. You want to be less than that. Like most hot tubs are 104 degrees. And so you'd want your bath temperature to be lower than that. Touch supervision. So that's the idea of, like, once you have the kid in the bath, you can't get up and go get a towel, right? You need to stay so that you can touch the newborn or the small baby in the bathtub the whole time, because they don't know how to hold their head up. They don't know how to not fall in the water. They don't know how to not slip sideways. And so you want to have all your stuff ready, your shampoo, your towel, your extra set of hands, your grandparent to run and grab the thing that you forgot for you, whatever that is, so that you can stay within touching contact of the baby while they're in the bathtub when they're little like that. When they're older and they can sit up, great, they can have a couple minutes in the bathtub. You got to stay eyes on them, of course, all the time, but you don't have to be right within arm's length of them once they're older. And then keeping them warm. So especially in that first week or two, paying really good attention to quick bath, wash, and then straight into a towel and back clothes on or skin to skin with parents or something to help kind of heat them back up. Because we all know the idea of taking a bath or a shower and then being naked for a long time around the house, especially in Alaska in the winter, not a super appealing thing, not appealing for the baby either. And then just from working in Alaska for a long time, and you guys all know this, more frequent baths in Alaska in January does not lead to better skin for a baby. And so you may decide that, you know, once they are moving around in the summertime, they may need more baths because they're getting in the dirt, they're out and around. And in the winter, when it's cold and dry, they may need less baths depending on where their skin's at. And then if they are a dry skin kid or it is January in Fairbanks, then lots of times after a bath, we're saying right after they get out, that's when you lube them up. So your thick, heavy, greasy lotion goes all over them. What I tell kids is the idea of you want to get the lotion on before the bathtub wrinkles are gone. So if they're in the bath and they get bathtub wrinkles on their finger, by the time their bathtub wrinkles are gone, they've evaporated all that moisture off of them. So you want to get them wet, soak them, and then smear them all over. Then they can run around the house and do whatever they're doing after that. But get them wet and then smear the lotion on them so it seals that moisture in from being in the bathtub. So get the lotion on before the bathtub wrinkles are gone. Okay, this is my favorite. Do I panic if my dog licks my baby's face? Okay, this is a genuine question and fear. And the reason I say that is because pets are important, right? We have pets in our home. We love our pets. The pets are the thing. They were my fur babies until all of a sudden I showed up with this loud, crying, smelly, puking, pooping thing. The pet didn't agree to have this happen. They didn't know that this was a choice that was being forced upon them. And all of a sudden your dog or your cat or your bird or your snake has a loud thing that has taken over the attention of the family and is present in the home. So I want to talk about pets for a second. Thinking about, just like you would with a sibling, thinking about if you have pets at home that are important family members to you, are there things that we can do to make it better for the pet, right? If you have a newborn in the hospital, take a blanket that smells like the baby home so that the dog can get a sniff of it before the kid comes home and have some idea what's about to happen. And then thinking about when you bring that baby home, how would you respond if somebody moved into your house without your consent or knowledge? Right? Like that's how these dogs, cats, birds, snakes, fish are feeling. This is my house and all of a sudden a loud noisy thing is in it and I did not agree to this plan and what is happening. Even the most mild-mannered, kindest animal in the world can have questions and be curious and trying to figure out what is happening. And animals' curiosity can look different than human curiosity. It can also look the same, but it can look different. And so thinking about, especially in that initial time period, not leaving baby and animal in the same space without supervision there so that you get a chance to kind of see how this is going and give your pet a chance to adjust to it. Just like we talk about helping toddlers, older siblings, cousins adjust to a new baby, pets are important too. And sometimes they may need a walk so they know they are still important. This is, again, something you could ask a friend to do if you need help. Take my dog for a walk. That would be lovely. And then pets do lick babies, right? Like you turn your back for a half a second and the dog's like, hello, I'm happy to see you, and licks the baby's face. So I don't panic when that happens. I think it's probably best practice to try to wipe the dog slobber off the baby's face or use a washcloth to kind of clean it, because if we don't have to have dog mouth germs in the baby's face, eyes, nose, mouth, probably a good idea to try to use it or to get rid of it. But you don't have to sort of head down that, oh my gosh, we have to go to the emergency room immediately moment. I kind of think about it the same way I think about it if a sibling licks the baby's face, right? A 2-year-old could lick a sibling's face. It does happen almost every day. We would wipe the slobber off. We would get rid of the boogers. We would say, don't do that again. And then we would move forward. And I think about kind of dog mouth germs, cat mouth germs in a similar fashion. They like to sniff babies. They like to see what's going on, what's happening over here. And then the biggest thing to kind of think about is the biting piece. So how do dogs carry baby dogs around? They use their teeth. And so sometimes biting doesn't have to be an aggression or a mean thing. It can be a, I'm trying to figure out who you are and what do I do with you thing from an animal behavior standpoint. So just thinking through that piece and making sure that you've got supervision. Older siblings can also bite babies, and so also something to be thinking about and paying attention to. You notice there are a lot of similarities between older siblings and dogs. And then thinking about the transition, right? So in the beginning you were thinking about how do I make sure that my animal is comfortable with my baby? How do I make sure my animal learns about this? It's sort of that protecting the baby kind of piece of it. At some point that shifts and the baby becomes a menace to the animal. And that is, babies are exploring their environment, right? They're grabbing, they're tasting, they're reaching for, they're pushing, they're rolling, they're moving. That's how they're exploring their environment. And I don't particularly like it when people grab my face and grab a hold of it. And so a dog will respond with a nip or a bite or that sort of thing. And so thinking about when you shift from how do I keep the baby safe from the animal, how do I keep the animal safe from the baby once they start grabbing things and moving things around? So it is a shift that happens there. How do babies learn? Go to the next one. Babies are the coolest, right? They learn so much in their first year of life. They go from not being able to walk or talk or have sort of significant communication. They can't see great in the beginning, to being able to crawl, to being able to walk, to being able to move, to understanding language, to having language back, to understanding social interactions, to having social interactions back. If you think about how much they change in that first year of life, it's amazing. Our brains are old and tired, and we could not learn that much if we tried in a year. And they do it without even really trying. It's so cool. And so what they're learning by is exploring their environment, right? That might be taste, that might be sound, that might be grabbing things and touching things. They are looking at things. Their visual development is amazing. They're hearing, they're touching, and sometimes they're tasting, right? Like those kids hit 2 months or so, everything goes in their mouth. Doesn't matter if it's disgusting. They put it in their mouth to find out what it is and start to learn those things. When they see those things happen over and over again, right? So a pattern, I touch this, I taste this, I move this way. That's starting to develop those brain connections of cause and effect, those brain connections of what is this, those things of, oh, this is my hand, right? You've seen that moment when a baby all of a sudden figures out that hand passing in front of them actually belongs to them and that they are capable of moving it as opposed to a random thing that happens. That takes how many times of passing their hand in front of their face before they learn that one's mine and I have control over it. The sort of expectations that they are building, so that doing something, seeing what happens, doing something, seeing what happens, that's the foundations of their early relationships, right? So I cry, somebody picks me up. I'm hungry, somebody feeds me. I'm cold, wet, tired, somebody helps me meet that need. That's developing those early brain foundations of I have a need and it gets met. That is what, when we think about sort of baby brain development, that's what we're trying to lay in those first weeks to months to years of life, so that as they go through life, they have the foundation of I have a need and I can meet it, or I can ask somebody else to help me to meet it, and having tools to be able to navigate the future. It's a balance. If you have all new things all day, every day, oh my gosh, by the end you're exhausted, overwhelmed, crabby, and mad, right? If everything is exactly the same every single day and there's no deviation or change or learning, it's kind of boring and you don't learn new stuff. And so it is that constant tension of parenting, of exposure to new things and developing routine, and exposure to new things and developing routine, and allowing kids to explore and develop and have new things in a safe and consistent manner. So I know when I am hungry, somebody will feed me. I know when I need something, somebody might not be able to get to it in 2 seconds, but they will say, be right there. I'm gonna get just warming up your bottle. I got you, sister. Hang on, I'm coming. They know that somebody is interacting with them in that way, and that helps them build skills around social relationships and emotional relationships for the rest of their life. Predictability and continuity are so important. And I don't mean you have to eat at 8 o'clock every day or else. I mean the idea that when I need something, that need is met in a consistent basis. And then routine. So I love routine. It's amazing. It's wonderful until it's not. So routine is fabulous. And I think it's really important to have a general routine, but then when are the moments when we got to deviate? We got to go pick up your dad, your grandma's coming into the airport. Oh my gosh, there's poop everywhere. We are going to have to not eat at 8 o'clock because we are taking a bath, even though it has been less than 3 days. Mm-hmm. So we have to think about how do we have routines as a baseline, but then have the ability to be flexible and have new exposures within that. All right. And the last one, this is the hardest one. This is why I saved it for the end. So a question that is not uncommon that I get either from parents or grandparents, what is the one thing? Like, that's great that you got 10, but what is the one thing that is the most important thing that I can do as a parent or as a grandparent or as a friend, family, caring member for this baby? Show up. That's it. Go to the next slide. What do babies need? They need somebody to pick them up when they cry. They need somebody to change their diapers. They need somebody to talk to them. Narrate your day. If you've been home with a baby for hours, you know that can get mind-numbingly boring in some moments. That is we're going to go over here. We're going to see if there's anything going on the TV. Oh my gosh, that pile of laundry is huge. Come with me, let's go look at it. How did you possibly spit up that much? You are one tiny human and there is spit up everywhere. That communication, that inflection, that engagement that you are having with that tiny human, that has a benefit in the long run. We can't measure it. I can't put a gauge on it. I can't tell you this is the % of the amount of time of minutes that you need to do that in order to have an A+ in the 4th grade. But what we know is those interactions from humans are what builds the foundation of success and brain development in the long run. You soothe them. Oh my gosh, I'm so sorry that you just pooped in your hair. That does feel cold and awful, doesn't it? We're going to get this cleaned up for you. You are using that soothing, engaging, I got you voice. And these moments are going to happen hundreds and hundreds and hundreds of times in that first year of life. Some of them, they're going to poop in their hair and you're going to say, oh my gosh, why did you just do that? We are late already and now we have to deal with this. That's okay. You got 99 others before tomorrow to show up for this kid. And it teaches them what to expect from the world. It teaches them how they can engage with the world. It teaches them how they can show up for others. And they're the foundations of how they grow. Interactions create connections. Babies learn these fundamentals, and they learn those all in the context of their closest relationships. I had the opportunity in doing these slides to Google top 10 baby questions. I'd recommend it. Some of this will look familiar. I picked different pieces from them. There are so many great resources out there, and I promise every question that you have had about what do I do with this baby or is this a big deal, it exists out there. I also found some really scary answers, and I hope none of my bosses are listening, because if they look at my internet searches on my computer, they'll find some sketchy stuff on there at work. And so I just want to say, again, there are tons of resources. One of the biggest resources is the people that you know. Ask a grandma. You know what? We flipped babies on them. They're going to give you the wrong answer half the time, and you're going to argue with them. Then you go Google it together, and you find out, and you both learn. But the ability to have that moment of vulnerability and ask your questions so that you can figure out the next step forward for your baby is so powerful and so important. And I just want to give a huge shout out to the grandparents, because you know what? You guys are so important in providing that context for where do babies receive care, how do parents get supported, who helps with the laundry, who holds the baby for an hour, who holds the baby while you get the other things next to the bathtub to do the things. And it takes a village. Everybody who's had a baby knows it is hard, and it is fantastic, and it is amazing, and babies are the coolest thing ever, which is why I'm talking about them, but it's not easy. And there's struggles every day, and there's moments every day, and every parent that I've ever talked to in a moment of genuineness has had a moment of, I'm not sure I can do this anymore. And so acknowledging that universal human experience and figuring out as we move forward, all of these questions, they all have some important things, and they all have no right answer. And so how that baby shows up is super important in the context of the family that they live with and what is right for that family. So I would encourage you to reach out to trusted resources. I would encourage you, if you are worried, come on in. We love seeing cute babies, and we love to talk about why they're doing great and wonderful and awesome, or why we need to spend some more time on it and try to figure out a different plan of what's happening. I will pause there. If there are questions, I'm happy to take questions. And I just, again, want to say thank you for spending your spring Saturday, or what day are we, Michelle? Thursday night, being here in this cold room. Yeah.
Is there a physiological advantage to swaddling? Why do we swaddle?
Yeah.
Because we didn't do that back in the day.
Yeah.
I didn't do that back
I
in the day.
know. Isn't it? I am partially fascinated by all the things that we change, because I think when we know better, we do better, right? Like that's what happens in medicine. We do move things on you, but you end up in this situation where we're like, what are we doing and how did we get here? I think the advantage of swaddling is that kind of, especially in the first weeks to months, that feeling they've been in a semi-confined place, right? So they've been in a uterus where they are used to kind of having that tighter feel. And so when they are looking for kind of comfort, we can get them kind of in that position of comfort again. The other piece is not having the loose blankets. So having the blankets that are tighter, so like the Velcro swaddlers or the folded swaddlers. So I know you're tight here, so I'm not worried a blanket is coming up over your face. Swaddling, I think, is the most kind of helpful in the first couple of months. So I'm not swaddling my 2-year-olds because they're gonna laugh at me and unvelcro it and be like, this is hilarious, nice try, mom. And then thinking about hips. So if you look at most of the swaddlers that we use in kind of the older kids, they're tighter or more, the Velcro or the wrap is on the top and the arms, but it leaves it so that their legs can come out. So I don't want to hold legs in this position because I want their hips to be able to move, because that's important for hip development. So you want looser on the bottom, tighter on the top, first couple of months. And so I think the physiologic advantage is kind of mimicking that cozy, tight comfort position, and you grow out of it. at some point.
They say something, parents are saying something about a startle.
Yeah, yep. So if you've seen little babies, usually first month or two, it's called a Moro reflex, and it's that kind of startle that they do where both arms come out and kind of shake, and sometimes their legs will do it. It's a reflex, so I can trigger it. I can make it happen, just like I can tap your knee and make your leg kick. It can be triggered by noise. It can be triggered by a surprise, or like they're sound asleep and all of a sudden you wake them up. They can also do it to themselves. So they can just be laying there and all of a sudden do it to themselves. And so the swaddling kind of holds that contained. So even if they do it, they just have a little stutter as opposed to all the way wake themselves up with it. So it can kind of give you that protection from a wake yourself up moment, or jump with a loud noise, dog bark, those sorts of things, because you don't trigger the reflex quite as much. Yeah, sure. Other questions?
So I haven't looked it up, so
Yeah.
I haven't done any homework, but I understand there's a real difference in what some young people are looking at feeding kids and maybe giving them what we would have considered not mashed, refined,
Yeah.
whatever foods, let
Yeah.
them chew on a chicken knuckle or something.
Yeah.
And going,
I know, that's one of the, besides flipping babies over, I think it's one of the big things that we've changed between generations. So from a starting solid food standpoint, so in general, I say most babies don't need solid foods before 6 months of age. So there are some of the like 5-ish or so month olds that are watching what you're eating and they're losing their minds, and you may not be able to hold them off from that standpoint. But 6 or so months of age, and you will hear everything in the book from what's the right answer. You have to do all the yellow foods before all the green foods. You have to do all the vegetables before all the fruits. Don't ever do meat. Oh my gosh, always do meat. That it has to be pureed, that you can never give purees. Like, you can find almost anything from a feeding standpoint right now as the right way. There's kind of a couple of things that I care about. So one is, I say the only food that you can't have before 1 year of age is honey. So we used to say peanut butter, we used to say wait on kind of meats or proteins, those sorts of things. The only food that you can't have is honey. Everything else is fair game. One of the kind of most interesting things over the last probably 15 years is we used to think delaying some of more of the allergenic foods, so like peanut butter, would decrease your risk for food allergy or decrease your risk for peanut allergy. We've actually found the opposite is true.
Wow.
So in kids that are higher likelihood to have a nut allergy, I actually want those kids to get exposed to little bits of nut protein earlier, and that actually kind of helps them develop a tolerance to it and be less likely to have food allergies. We got all kinds of protocols and details and things about what does that look like and how do you do that safely in high-risk kids. But lots of the rules that we used to say about be careful about the allergenic foods, we've actually shifted quite a bit in the last 5 years. So I care about you get a wide variety of things, and that honey is the only thing not to get. And the reason for that is botulism toxin. So botulism toxin is in the wild, it's in the dirt, it's out there and around. And bees land on the dirt and in the flowers, and they carry it around. And babies don't have mature guts yet, and so that's the why on the honey piece of it. And again, it's not like at 11 months and 30 days, honey is poison, and at 12 months it's totally safe and fine. But that's about when we think your gut maturity is in such a place that you're less likely to absorb it if you were exposed to it. The other thing I care about is texture and choking. So this is the kind of the idea of, we used to always do purees, that you fed purees first, and then you went to kind of a thicker paste, and then you had some pieces that you picked up. Kind of the idea of baby-led weaning and a little bit more solid food. There's nothing wrong with that either one of those is fine as long as a kid's getting nutrition and as long as it's a texture and a form that they can handle. So what I don't want is a kid to get a piece of steak at 6 months old, right? If you're gonna have meat, it should be pureed, it should be thinner, it should be a product like that, or it should be cooked to a point that it is soft and it is spongy and it will fall apart when you put it in your mouth. So that can be super overcooked, soft, mushy green beans, or that can be green bean puree. Any and all of those are okay, but it's gotta be a texture that they can handle. And so Again, there's lots of ways that people like to do this, and I think that's really an individual family choice, and there's not a wrong way to kind of approach that, but I think there's much more variation in that than there was 15 years ago in terms of the way that people are doing it. Yeah. And protein's good, and iron is good. And I think we did a lot less of that in the past, and we've kind of focused more on that now. Okay, cool. Thank you guys. Yeah, of course.
I have a list, but I didn't want to go first.
You're totally good. Yeah, no problem.
That's the whooping cough.
It is.
Do they ever separate, like whooping cough? Can you get just that?
Yeah, so so the Tdap vaccine, the name Tdap, so we have to be confusing. So we have Tdap and DTaP. So Tdap is the mom one, DTaP is the baby one. That they both have the whooping cough in them. You can get them separated. Most places don't carry the separated one, so the diphtheria part, the tetanus part, the whooping cough part, but some pharmacies can order them separately, but most places don't have them. So you just have to work at it to find them. Getting the Tdap vaccine in pregnancy, then mom makes antibodies against whooping cough, and those beautifully transfer across that amazing placenta and are hugely protective against hospitalization for whooping cough in the first 2 months of life.
And is that one of those then that does ebb after a while, so you don't want to think that that's taking care of your baby?
Yep.
For the
Yep.
long term?
So mom antibodies are amazing. They cross in the breast milk, they cross in the placenta, but once you're not connected to mom anymore, they eventually wear off. And so the Tdap vaccine is true. I can't remember the numbers off the top of my head, but it's some super high percentage, like 80%, protective against hospitalization in the first couple of months, which is what I worry about. That if you have to be in the hospital as a baby, it's a bummer. And so it's great in the first 2 months. Then the baby has to get theirs at 2 months because they're no longer getting it from mom. Yeah.
And then what is the risk, like the first couple months going out in public? If you're baby wearing, what is the risk
Yeah.
going out to like Fairbanks or walking through Alaska land?
Yep.
Bigger crowds if your baby is pretty close to you?
Yeah. Great
And
question.
people aren't touching.
Yeah.
Is that still the same amount of risk as like going to just grandparents?
Nope. So it is similar risk to, sorry, I didn't hear the second part of your question. It is similar risk to probably going to just grandparents. So you are totally doing a great job highlighting all of the important pieces of that, right? Like being outdoors, always lower risk from an infection standpoint than being indoors. We have wonderful half the year that we can do that. The second half of the year are a whole lot harder to get a baby worn with a hat and a snowsuit and all the things to get out the door. By the time you're all bundled up, you're like, we got 5 minutes before you have to eat again. And so sometimes if you're having a baby in the summer, fantastic. Go outside, go all the places, because being outside is hugely, hugely protective from a transmitting of illnesses standpoint, particularly if you're highlighting exactly what you're saying. I got you right here. I'm not handing you to the neighbor to walk through Fred Meyer's with. I don't have you open for people to kind of sneeze on, look at, be like strangers coming up to the cart and being like, oh, that baby is so cute, achoo, right? Like those are the riskiest things. So baby wearing outdoors, those sorts of things are way lower risk. You have to go to the store, right? Like you can't not go anywhere for 2 months, or you can send the friend to the store. There you go. Yes. But the ways that you can decrease that risk are exactly what you're saying, which is wearing, facing forward. That again, babies are going to have to go on airplanes because they got to go visit grandparents and they got to go see family and those sorts of things on the airplane. You know what? Yes, I do have a super cute baby. Look, they're right here. Right, exactly. And so it's how do you do that in a way that you minimize that risk, and you're highlighting all the important pieces there. So yeah.
And since I am having like middle of summer baby, I'm thinking, awesome, go out in the yard, lay in the sun, but I'm hearing can't be in direct sunlight. Like how much?
Yeah.
Like, okay, just taking him out to the car, probably
Totally fine.
fine.
Yep.
But like, how
Yep.
much should I want to lay out in the sun myself? But I also want to breastfeed. Should I
Yep. Yeah.
We were always told shade.
Yeah. Shade is great,
But you know, that's changed.
And you can, I know we did change everything on you, didn't we? I am so sorry about that. I apologize. I hear the trauma and I am so sorry. That I would agree from a shade standpoint, that's going to be ideal. There's a million ways to get shade. So a hat, a long sleeve shirt, in the like bucket baby carrier with the top over it. There are baby tents that you can get, like shade tents. There are these umbrellas. You can use a chair, right? Like there are all different tools that you can get to create shade in that moment, so you can have your 15 minutes of, I gotta get my sunshine.
Well, because they're going to burn faster.
Yep, exactly.
Yeah.
Yep. Yeah. Yeah.
But, yeah.
Yeah.
And then I've heard that it also, I've heard that they can lose weight, like immediately out of the hospital.
Yeah.
Concern.
Mm-mm. So I expect all babies to lose weight in the first few days of life, that's typical. We have kind of amounts that we're thinking about and that we're looking at. And so I expect them all to have a dip and then come back up. A dip is a problem, but a dip and come back up is what I expect all babies to do. So, yeah. And we help you with all of that.
And then how, since babies cannot talk,
Yeah.
I've never understood how people can tell, oh, my baby's gassy, or
Yep.
they're definitely sick, or they have an ear infection.
Yep.
Like, do you just look for the signs, like snotty nose, or
Yeah.
crying, or
Isn't it like a totally unfair Rubik's Cube? You're like, this is infuriating. So, yeah.
loaded, like,
Yep.
yeah.
So sometimes you don't,
Okay.
right? And so being comfortable with the discomfort of knowing, I'm not sure what's going on right now, but you know what? I'm going to keep thinking about it. I'm going to keep looking for signs. I'm going to keep looking for pieces there. So it would be lovely if they could talk and they could be like, here's what's going on, Mom. But they can't. And so you do kind of end up going through your list of trying the common things. And then the more time you spend with your baby, the more you learn about that cry is different. This one is different than this one. And that just takes time of doing it. So the first few weeks, you're like, I have no idea, right? Like they are crying again. But as you kind of spend time with them, you learn that one is different. I got to go see what's going on with that one. And exactly like you're saying, from a ear infection standpoint, they usually have a fever, or they're snotty, or there's other things that kind of put you down that path with it most of the time. Yeah.
Okay.
Yeah. You're doing awesome.
Okay.
This is great.
That's a perfect place to ask.
Yeah. Yeah, absolutely.
I've been hearing different things about in the first, I don't know how many months, but so many months. Do you absolutely have to wake them to feed them?
Great
Or
question.
if they're sleeping, how long do you let them sleep
Yeah.
before you know you need to feed them?
Yeah, great question.
What age is that?
You're going to love my answer. Ready? It depends. Yep. So, how often do you have to feed them, and can you let them sleep? Do you wake them up to feed them? And so, totally not fair. First few days, if they're losing weight and I'm really paying attention to that, I'm going to be like, you know what? They can't go more than 3 hours. I need you to wake them up at this point and do it. Once they start coming back and gaining weight, oh my gosh, if they give you 4 hours, let it happen. So it depends, you get a nap in that moment, right? So it depends on where they are kind of in that feeding journey and how old they are. And so that's the hard part about it. It's totally unfair. You ask us a question, we tell you an answer on Monday, and then you ask us the same question on Wednesday, and we give you a completely different answer. And so it feels like this moving target, and part of that is you're changing what you're doing based on the place that they're at. So my answer the first week or 2 weeks of life is very different. If it's a medically complicated kid or a preterm infant or has other pieces, my answer is very different. If it's an older kid and they are regulating their sleep, don't wake the sleeping baby. let them go, and then we'll feed them. But all of that kind of depends on where they are at in their journey and how old they are there. Yeah. So ask it, because you'll get a different answer at each time point depending on where your kiddo is at.
Thank you.
Thanks for bringing a list.